We love to feature the expertise of our great staff here at FCPH, and today we have a double dose in store for you. First, we chat with Alex Jones about her role with infectious disease control and response, and we have some fun coming up with vaccine ideas to prevent some of humanity's worst flaws. Then later, we speak with Mary Nern about healthy food, access, education, and we share some healthy food options from every color in the rainbow. We discuss all that and more coming up on Health is Real. Come on in, stay a while. Andrew Stinson is here alongside Angela Taw and Zach Watson. The name of the podcast is Health is Real from Franklin County Public Health. Coming to you today, as we often do, from Memorial Hall in downtown Columbus. Angela, how's it going today?
Pretty good. How about you?
I'm doing great. Zach over there, how are you doing?
Certifiably okay.
Certifiably okay. Excellent. I love that. Certifiably okay. Well, I'll tell you what, I'm very excited for our guest today, Alex Jones, Assistant Health Commissioner here at Franklin County Public Health and the Director of Prevention and Wellness. Alex, how are you doing today?
I'm doing great. Thank you so much for having me. This is amazing. Highlight of my day. So Thank you.
Thanks so much for coming. So I guess just a little bit of background about you. How did you get here and how did you get involved in public health to start?
Yeah, so I'm a nurse by trade. So I went through nursing school at The Ohio State University. Amazing.
Let's go.
Yes, go Bucks. Yes, it's been a great time for us. But went through nursing school, and I got about halfway through, and I was thinking, I'm like, I don't know if this is for me. I had the end of that feeling. I'm like, I don't know if this is the work I want to do. I had an opportunity to go to a community health practicum clinical experience, and for lack of better terms, like the angels started singing. I'm like, oh, this is what I want to do. This is what I was meant to do. And I had the opportunity my senior year of nursing school to intern at Columbus Public Health and the TB Benjamin Franklin Clinic, and knew that I was really interested in public health, and that's what I wanted to do. And so I did what any reasonable nurse did. I said I needed to pay my dues, so I went to the floor and worked several years at the bedside and did that, and was able to go back to grad school and become a nurse administrator and get my master's degree that way. So that's my little bit of my journey through nursing school and how I ended up in public health. And that was back in 2010. And I actually was able to start off at a local health department called Union County Health Department, which my friend Zach Watson was at. Is that Union County Health Department?
Respect UCHD.
Oh, yes. I love them. Love all the people there. And they took a chance on a new grad and really kind of set my career in motion. So I have so much respect for the folks at Union County Health Department, from Dr. Orsina down. I know he loves being called Dr. Orsina.
Oh, he totally does. We love you, Jason. We love you, Jennifer Thrush.
Oh, Jennifer Thrush. Yes. We love all of them. And great friends and colleagues. So
Thanks for sharing. So I know you have kind of a long title, but one wrapped up in there is Director of Prevention and Wellness. Can you tell me what sorts of things you're directing here at the health department?
Yeah, happy to. So there's three main programmatic areas that I oversee at the health department. One of the big ones that has gotten a lot of attention and time over the last several years has been our infectious disease control and response. So we, anytime there's a reportable disease condition in Franklin County, we manage that and respond accordingly. Also, our immunizations and school health program. We operate clinics here for our community to make sure everybody's up to date on vaccinations. And then finally, our maternal child health work. So we have some amazing public health nurses and coordinators that do a lot of the day-to-day work in our maternal child health space. So, and then fun fact, I'm also, as Director of Prevention and Wellness, I'm actually part of the Triad, which is here in Ohio. So all health departments have to have three separate positions. So you have to have a health commissioner, a director of environmental health, and a director of nursing. So I also serve as the director of nursing. So that is my
another title.
Yes,
okay.
yes. So I am the director of nursing. So that is part of our quote unquote triad.
Are you Surgeon General? Did I hear that too?
No,
okay.
no.
I'm sorry. I thought you were Surgeon General also. My bad.
That'd be
I
super
apologize.
cool. That'd be super cool. But no, but yes.
Well, and going off of that question, health departments pop up because of the need for prevention and wellness. How do you deal with medical mistrust while providing services that are so vital to the public?
Yeah, I think one of the big things, and that's a benefit to us, is that we are nurses. Many of us are nurses and other types of health professionals that have inherent trust. And like, we don't take that lightly. And I think nurses continue to be the top rated trusted profession for like the 23rd year in a row, which is exceptional. And so just making sure that we are providing the best information so that they can make the most informed decision for them and their family. That we're not here to tell them what they have to do, even though I know sometimes it probably feels like we are telling them that, but really that we have their best interest in mind and that we want them to be as healthy, as safe as possible. So it definitely is a balance. There's a lot of not true sources out there that we have to combat against, but at the end of the day, most people are open to having those conversations and are kind of in that, not to use a communication term, but that movable middle that we can influence and just have some of that education and conversation.
That's great. That's great. Now, I've heard a lot about this new mobile unit. Can you speak a little bit about what that is?
Yeah, we're super excited for it. This is an amazing opportunity that we received from the Ohio Department of Health through one of our funding sources. So it is what it sounds like. It's a medical clinic on wheels. We have a clinic room back there. We have a bed. We have availability to take medications out. And this is really going to be amazing for our community and our partners. So we are going to be offering education on the clinic as well as some direct care services. So thinking immunizations, and then also partnering with our harm reduction team. So naloxone, fentanyl test strips, those type of services as well. So I know a couple people in here have driven the mobile unit.
I was going to say, I think someone on the panel has.
Yeah.
I don't know if she wants to speak on it or not.
It's terrifying.
Was it terrifying?
Yes.
Oh, no.
Okay, so here's the thing. I have a 20-year-old little RAV4. I mean, she's very compact, easy. I know what's around me. She's got big windows. And then I drive this massive thing. It's very hard to see. But we figured it out. I had more giddy up than I was expecting, so that was good. But yeah, those things are pretty big. Those mobile units are massive.
It is. I believe it's a Ford 450 that is towing that. So, I mean, it is a decent size. And yes. I've only driven it in the parking lot, so you are one up on me.
Well, and Angela, you designed the outside of it, right?
I did. The first time I ever designed a wrap for a vehicle.
And it is an awesome wrap.
You were talking a lot about the different services that are sort of underneath your umbrella. And some of them are more traditional public health roles, like immunization and things like that. But then you mentioned maternal child health, which maybe some people don't know a whole lot about. How do you decide sort of what programs to bring under the umbrella of prevention and wellness?
Yeah, I think for us, really looking at the data, and I know colleague Sierra, our epidemiologist, was on, who talked all about data and had those conversations about making sure that we are looking at what kind of gaps we have in the community, what our primary data sources are telling us, but also our community members, like what are they struggling to access and to find. So for us, one of the areas that we grew, talking about some of the maternal child health work, because we know that even when we control for certain factors, such as like education, employment, what have you, that there are systems that are happening that are impacting these health outcomes. So trying to provide these intentional home visiting services for our community that are very personalized, customized, and family driven. So that's one example of something that we've done in prevention and wellness to really try to meet that need.
Well, Zach, do you have something?
I have a surprise game that I've told no one about.
No.
Classic.
Wonderful.
Oh, no, indeed. Andrew, go ahead and hit me with an Angela sound effect of your choosing.
Oh,
Give me a
An
good one.
Angela sound effect. All right, let's go with.
Getting cold, getting weird.
Perfect.
Getting cold, getting weird.
Hit it one more time, please.
Getting cold, getting weird.
All right, let's do it. Let's get cold. Let's get weird. Am I right, Ange? All right. No, I'm not right. All right, so listen. I thought of this game on the fly, and it's a really simple thing. So you work in the world of vaccines, where miracles have happened for us to sort of use vaccines to prevent diseases of all sorts of types. But wouldn't it be fun if there were vaccines to prevent some of humanity's worst flaws that aren't diseases?
Ooh.
So this game, and because you're our guest, I'll have you go last, so you don't have to come up with something instantly on the spot. This game is if you could make a vaccine for some type of human flaw or societal ill what would it be for? So I'll go first, and I'll let my colleagues go. But I would, if I could make a vaccine to just have people do the zipper method on the highway. Like, you know what I'm talking about? Like, one car goes in, the car in line goes up. So there's all sorts of people that try to bottleneck in traffic, especially at the 71 exit. Hint, hint, if you are listening to this.
Do better.
Yeah, 71 on the 270 exit. It's a sincere problem. But yeah, so people just try to go up as far as they can and wedge their way into traffic, which then, makes traffic slower rather than if everybody just did a single file line and turn method.
That'd be amazing.
It would actually go, slightly faster. So that would be my vaccine choice. Andrew, what about you?
Wow, that was very specific.
Sure was.
A vaccine to fix a human flaw. A vaccine that would, I'll stick with the automobile theme here.
Okay.
I like it.
A vaccine that would make parking available whenever and wherever it was needed.
Ooh.
I hate having to figure out where to park, especially, downtown. So like always knowing that I can park somewhere. I don't know how that vaccine would work, and I'm not going to get into the specifics of that. But if it could work, that would be my pick.
Mm.
All right, Ange.
Oh, I would probably have a vaccine that fixed the human flaw of littering.
Nice.
Like there's just trash everywhere, and it
There
makes
sure
me
is.
sad. And after the trash gets picked up, I literally walk around my little loop around my neighborhood and just pick up everything I see because it makes me sad. But and it destroys our environment, so that would be mine.
Look at you being good, upstanding member of your community. That's really great.
We all can do our little part,
Yeah,
Yeah.
mine was selfish, and yours was like help the world. So yeah, that makes me not feel so great. All right,
There's all kinds of different range and spectrum. Absolutely.
Yeah.
Absolutely.
Alex, do you have one?
So I don't know. You guys had such good ones. I don't know. So this might be, I don't know if this is exactly what you're looking for, but for me, I would like something. I hate when I walk by somebody and they don't like smile.
Yes.
I don't know. Like, I just want people to be
Yes.
nice. And I think like we get a lot of that here, but
Yeah.
like you go to other cities and people just are like very flat, or they kind of give you like a mean mug a little bit. So yes, I would give that. So everybody's just, even if it's a fake smile, I'll take it. I like
Yeah.
it.
I think what you're talking about is this is a very uniquely Midwestern thing. So we call it the Midwest vaccine, not the Midwest virus. That'd be great. Actually, it would be great if
Midwest
I caught a virus that makes me be polite to others.
Yeah, I love it.
Yeah, because you're right. Because when you go to like a New York or any other like major city, LA, Dallas, like it's just a lot of like sort of straightforward look, or like not a. And here it's all howdies and opes, like those things. So
Oops, let me scooch by you.
yeah,
Excuse
sorry.
me.
Yeah.
Sorry.
Yeah, sorry.
Yes.
So
Yeah.
Yes.
true.
That would be my human condition.
Love it.
Love it.
Excellent game choice, Zach. Nice thinking on the fly for that one.
Absolutely.
Alex Jones, she is the Assistant Health Commissioner here at Franklin County Public Health and also the Director of Prevention and Wellness, and other titles to be named later.
There you go. To be determined.
Thank you so much
Job
for coming
security.
on.
Thank you.
And I'm really excited. Our guest, Mary Nern, is here. She is the Healthy Food Access Coordinator here at Franklin County Public Health. Thanks for coming on, Mary.
Thanks for having me.
Now, tell us a little bit about your journey here to Franklin County Public Health.
From start to finish, or just
Start from birth and end with today.
Perfect. So I was born at the Good Samaritan Hospital in Zanesville, Ohio.
Amazing.
And
Zanesville.
if
Yeah.
we flash forward 21 years, I graduated with a psych degree from Ohio University in Athens. And I was pretty unsure of my next steps, as most people with psych degrees are. And so I worked for 2 years at Athens County Children's Services. And as a caseworker there, I kind of saw firsthand a lot of the results or like day-to-day things that people experienced with varying access to healthcare. So I saw a lot of social determinants of health kind of in action shaping the people's lives that I worked with. So one of the things that I was thrown into in that position was doing a lot of kind of informal health education when I was there. So having lots of difficult conversations with parents about like relationship health and things like that that kids just like weren't learning in school at all. So I knew right out the gate that that was not the career for me. So when I was done there, I kind of took a year off. I nannied and I explored my career options. So one of the things I did was an internship with Planned Parenthood, and I shadowed their peer education specialist. She had a CHES and she was working on a master's degree in health ed. That kind of opened me to the world of health education as like a career path. So I went to Kent State from there, got my MED in health education and promotion, and then I kind of knew I wanted to move to Columbus. So that's why I'm here.
Nice.
Love it.
That's awesome. So healthy food access coordinator, tell us more about that. What's really in your purview? What's under the umbrella? What kind of programming do you work on?
So I'm on the health promotion team, which we do a lot of general outreach about FCPH's programs and the things that we offer as an agency. But for healthy food specifically, I guess I can get a little bit into my like professional philosophy as a certified health education specialist. Sure. My role personally is to help people have access to the information, attitudes, knowledge, skills that they need to make healthy choices. So a lot of the things that I do are centered on that. So helping people learn how to incorporate healthier foods into their diet. We do a lot of quick outreach. So giving people like engaging quick facts that they can take home with. We have our smoothie bike that's very engaging.
Fun.
I'm working on a curriculum for community gardens with growing your own food and making those connections with healthy eating and active living. So I'm working with my colleague Natalie on that. I serve on a few coalitions across the county. So Growing Healthy, or I think it's called Healthy Kids Coalition now. We're involved with the Franklin County Local Food Council, which is actually a collaboration between the city and the county. They do lots of work on like food waste, urban gardening, policy work around what people can grow and where they can grow it. And it's unique in that it's a collaboration between the city and the county, which you don't really see in a lot of other places. So that's really interesting. And then I'm also on the Ohio Farm to School Network. So it's just a lot of collaborating with community organizations and lots of work through our community health action teams as well.
Nice.
Nice. And really quick, Mary, before we get back to sort of our pre-scheduled question here, for 2 follow-ups so that people at home know, tell them about the smoothie bike if they've never seen one.
Yeah. So the smoothie bike is a stationary bike. It has one wheel in the front that powers a blender. So as you pedal the bike, it stays in place, but it powers a blender. So it's a really good tool for helping people connect the importance of fueling your body to move your body. And then it's also a really great method to get kids to try different smoothies. So slipping spinach into a smoothie or having kids create their own smoothie recipes and blend it on the bike and then try it. So it really helps connect with, especially with the community gardens. You grew this, now you get to prepare it. Now you get to try it and then talk about how you liked it. So it's a really good way to kind of, 1, get people to stop at your table and then 2, walk away with something new that they learned. Yeah.
And so, for folks at home, if you see the smoothie bike out in public, try it out. It's very fun and you get a delicious smoothie out of it. So, and then the second comment you brought up the Farm to School Network. Do you have like an explanation for folks who might not know what that is?
Yeah, so Farm to School is a nationwide initiative to get more locally grown foods into the school system. So the Ohio Farm to School Network, it's getting kids involved with learning how to grow their own food. And then, like I said, kind of tying that into like taste tests in the school so they can grow the food in their classrooms, try it, and then learn about like what can be grown through Ohio throughout the year. So I know we all live in Ohio and you think that you can't grow through all seasons, but there's actually lots of ways you can. So OSU Extension has developed a curriculum that teaches teachers how to grow from August to May throughout the entire school year. So that's one of the things that they're pushing out in Franklin County. And then the other side of Farm to School is procurement. So working with food service directors to incorporate local foods into their menus so that kids have fresher, healthier food to try at school.
Nice.
Very cool. Before this next question is asked, I just want to say that
while Mary was going into like very sincerely her background, I saw this question. I didn't know it was worded this way, and it just made me really laugh. And I was trying not to burst out. But yeah, that's why I was like, when you were talking about your history, I laughed because I saw this ridiculous question.
Well, let me read it exactly as it's written, and then you can answer it however you want. So, where did the food pyramid go, Mary?
So, when the food pyramid disappeared, I think I was, 15. So I actually don't know.
It's still missing?
We haven't found
We have
it.
to
It's
find
never
it.
been seen since.
Wow.
I think it's important to help people understand how they can incorporate healthier foods into their diet.
Yeah.
Especially for kids, because it can, kids that don't have access to healthy food, they're not going to learn in school.
Yeah.
They're going to be tired. They're going to be too focused on where their next meal is coming from. So if we're able to tie healthy food into everything we do as a community, then we're setting our next generation up for more success as well.
Yeah.
Another thing is healthier foods keep you full longer.
Mm-hmm.
So if you're able to eat a healthier meal, you're not going to be as worried about where that next meal is coming from.
Yeah. But I like what you're saying about, like there may be sort of like the pinnacle recommendation, the ideal, right? But even just sort of like taking some pieces of that and incorporating that into your diet is better than nothing,
Yeah.
So and I think that hits on the piece that you're talking about being culturally sensitive and, understanding where people are at financially and different things like that. Like not everyone's coming from the same place and can reach that pinnacle of ideal food recommendations as easily. So even just taking a couple bits and bobs from it and plugging it into your life is great.
Yeah, and so going off that, so if you're someone who's looking to improve their diet, right, it may seem daunting at first to think about getting healthy. What tips would you give someone who doesn't know where to start with that?
So I will preface this by saying I'm not a dietitian or
Yeah.
nutritionist, but instead of going from 0 to 100, I think it's best to make small steps towards eating healthier. So maybe you replace your soda or your Gatorade or your Powerade with a water. Water first for thirst is huge, and we get a lot of calories from the drinks that we drink, even like a latte in the morning. So water first for thirst, switching a latte to maybe a cold brew or just a black coffee with a little bit of cream and sugar rather than a super heavy like milk-based drink.
Mm-hmm.
Swapping out half of your grains with whole grains. It doesn't have to be these huge steps, because if you know anything about habit forming, if you try to do everything all at once, it's not going to stick. So if you make
Right.
small, tangible goals for yourself, and center foods that you enjoy eating, then the chances for success are going to be higher. So like I said, whole grains. If you want Doritos, then have some Doritos, but also have some carrots. Like pair what you really want with something that you need.
Yeah.
That can be a really helpful tool as well. And then portion control is big. I'm very big on everything in moderation. So as long as you know the recommended serving size for you, not what's on the bag, because that's not actually the diet, nutrition focused serving size. It's actually what people tend to eat. So knowing how to read nutrition labels and figure out what your body needs to be healthy is really important.
I love the mental image of a carrot in a Dorito. That'd be such an interesting flavor combination.
Yeah.
A carrot Rito combo. If you will.
Yeah,
Yeah.
Carrito.
A Corito.
Whoa.
Yeah.
That does not sound great.
Well, yeah, and I'm glad that you brought the moderation piece up, right? Like a lot of people in my life, friends have always been like, "Oh, well, you're in public health, so you would tell me not to eat this," or no, I don't. In public health, we don't view that as a realistic view at all. Like that we just want you to live a happy, healthy life, and part of living a happy life is sometimes having an Oreo. Like food is a source of enjoyment in life. So I'm glad you brought up moderation. But I have created a segment for you, and I think it's going to be great because I made it. So, ladies and gentlemen, this is our newest segment on the podcast that we did not ask Mary permission to do, and it is called "You Gonna Learn" with Mary Nern.
Yeah.
We'll have a song eventually.
Cheers.
Oh God.
Wait.
Wow. The live studio audience is
Yeah,
really
they're getting into it.
They're digging
Very
it.
excited.
Now, Mary, for this one, we wanted to start off nice and easy for folks at home. And, you know, it gives us like a sort of good base for future You Gonna Learn with Nern episodes. So we wanted to talk with you and ask you for each color of, or I guess a rainbow technically with an extra color that someone threw in here. We wanted to ask you what your favorite healthy food of each color was. So I'm going to go down the list. If you want to just tell me what your favorite is, and we can even go, we as a group can discuss it more if it's a good pick or if there's like a different alternative healthy food of a color anyone wants to throw out, please, by all means, participate. So
Why are you looking directly at
I
me?
don't know. I think I'm looking at you because like, is this a bad idea?
Yes.
No, I think it's a great idea.
Yes.
But I can't promise
See
what's
what
going to
happens.
come out.
Yeah.
Look, I'm not gonna lie. When we get to orange, carrot Rito. Carrot Corito.
Corito.
I'm sorry,
There you go.
Corito. All right, so let's start off with purple.
This one's hard because I feel like the red purple range in vegetables
True.
and fruits is
Yeah,
like really
you've got
nuanced.
eggplant and you've got
Yeah.
grapes.
Which
is like the top.
I prefer green grapes and I hate eggplant. So
Okay, what about like
no.
a red cabbage?
I
That's
do-
kind of purpley.
I love a purple sweet potato.
I love it.
Oh.
Oh
Yeah.
yeah.
Love.
didn't
even
Love
like
sweet
a-
potatoes.
A plum? Is a plum?
Oh, I like
purple?
a plum.
yeah,
Yeah,
that's
yeah.
a good one.
So
My
which-
brain went to sweet potato. My brain went to the purple bag of Dorito, which I would eat with carrots.
Absolutely.
can we get a check on if there are Doritos of each of these colors, please?
It's a corn chip. That's
sure
a whole
there are.
grain.
There you go. I love it.
Yeah, purple sweet potatoes.
Okay.
Delish.
Love.
Okay, I love that.
Where do you even find something like that?
In season, like at the farmers markets,
Yeah.
or I feel like honestly, the international grocery stores have really excellent produce choices, and they're
So
usually a little more affordable.
I
So
love that.
Good point.
Yeah, that's a root vegetable, notoriously healthy for you. So, so we're gonna go right down the range here. Red.
strawberries
Love
in
good
strawberry.
season.
Yeah.
Yeah.
Tomatoes was what I was thinking.
Oh yeah, definitely.
Tomatoes in season too.
Yeah.
An heirloom.
Oh, absolutely. Or even just the little like snacking
Yeah.
ones. Ooh, that's my favorite.
I like it. Andrew, any sort of red health? Are you an apple guy?
I do like an apple. I'm going to double down on strawberries, though. That would be my
okay.
choice.
Yeah, nothing but love for strawberries here. I agree. I enjoy strawberry more than an apple. Find me, doctors. I don't care. I didn't know what else to say.
A strawberry a day, I don't know.
A strawberry a day. Eat it, doctors. I
little
do what I
aggressive.
want.
Yeah, wow. Why are we hating on doctors so much?
I don't know.
Moving on.
It's the bit I've created. Yellow.
Okay, not to eat really, but as like an extra little spritz, I love lemon in my
yeah.
water.
Yeah.
I don't like bananas, so that's
Really?
the obvious
Yeah, yeah, yeah.
choice.
Yeah.
It's a lemon for me.
Okay. I was going to go banana.
Banana. You.
Well, there are Gatorade flavors of all of these colors. So the yellow Gatorade would be my choice for
Oh,
the
boy.
unhealthy
That's not a
version.
fruit or vegetable.
But bananas.
Okay.
Bananas.
My answer here is yellow squash. Actually.
Okay. That's a good one.
Yeah, I kind of like I'm just kind of mildly okay on bananas. It's not the first thing I go for. Lemon I do like, but it's definitely just a little bit. I'm not a big lemonade guy. So yeah, yellow squash. That's a good range of answers. I
Yeah.
really enjoy that one. Orange Corritos, obviously. So
Moving on.
Orange, Mary. What do you like out of that one?
I do love a carrot. I've been into the TikTok famous carrot salad lately.
Oh, I don't think I know that one. Tell us about it.
So it's just like you ribbon the carrots with
Okay.
like a shredder, or not a shredder, a peeler,
Mhm.
and then soy sauce, rice vinegar, chili crunch,
wow.
green onions, sesame oil, sesame seeds.
That sounds so good.
So good.
I
It's
would
so
eat
good.
that all the time.
For the listeners
so
at
good.
home, I saw Angela's soul leave her body.
Yeah.
It's delicious.
Out of excitement.
Yeah, out of excitement. Yes.
It's
Alright,
like,
I'm gonna
I
have
don't-
to make that when I go home.
The cucumber salad went viral a while ago.
Yeah.
It's the same thing but carrots. But they're like, oh my God, it's so good. It's really so good.
Nice. Andrew, what about you guys? Any
I was
difference?
gonna say butternut squash.
Oh, okay.
I am a sucker for some butternut squash. It's so good.
Yeah.
I'll go with the easiest one, which is the same as the color. I like a good old orange.
I do too.
A lot of fruits for you.
I thought that was kind of the point, but
Jesus.
fruits and Gatorade.
Fruits or vegetables.
Well,
and Doritos.
And
Doritos.
I mean, the carrot Doritos is a given. We've
Yeah,
all
yeah.
said
Carrot
that,
Doritos
so that's
is
on the
very
top
list.
tier, top tier.
I would also say orange juice. That was my answer because I don't do it anymore, but I used to get like really snobby at breakfast places because like Tossie down in the short north, may it rest in peace, when they first opened, did like hand squeezed like orange juice, like legit like from fresh oranges, orange juice. You can always tell.
They do that at Lucky's too.
They do that at Lucky's. Oh, okay, I need that. But yeah, I love fresh squeezed orange juice. I don't really care for like the processed like sugary like packaged stuff. Like, but yeah, if you have a person like squeezing like 10 oranges for one glass of orange juice, I'm so in because I'm really bougie. So good answers on that one. Let's go with green.
I love a cucumber.
Mm.
I love broccoli.
There's
Yeah.
like so many to choose
I
from in
love
this
like
color.
a good chopped salad with like 14 ingredients.
Yeah.
I like green.
Yeah.
Yeah.
This is going to sound kind of strange because I feel like neither one of these many people like, but I'm struggling to choose between celery and Brussels sprouts.
Ants on a log or just celery?
Oh, ants on a log. Absolutely. With chocolate chips.
I was just gonna say the ants
Yeah.
are chocolate chips.
Well, you have to clarify because many people think that the ants are supposed to be raisins, and I disagree.
Yeah, fully
Completely.
agree.
Yeah.
If you have tried something and you didn't like it, either it wasn't prepared in a way that, like, there's certain things. Like,
Yeah.
I do not like mushrooms. But if you've tried something and you didn't like it, I feel like it's probably because you didn't like how it was prepared.
Yeah.
To finish off green, so I like all of the choices here except celery. What a garbage vegetable.
Oh wow, we got some conflict here.
All right.
Ants on a log. It's like, okay, you've added stuff to it, so I know that you're like a good person. But I would say I've enjoyed kale as kale
Yeah.
sort of like came up the past couple years or whatever.
Through the millennials.
Yeah, through the millennials. Do enjoy myself.
The
with
white
kale.
millennials.
The white millennials. That
Real.
is very accurate. But I would say my top two are broccoli or green peppers. Like, I
Oh,
just-
yeah, green peppers are good too.
Yeah, love a good green bell pepper.
There's literally just unripened red bell peppers.
I like the mildness of them though.
Okay.
Yeah.
I'm not a
Okay.
red pepper gal unless it's
Really?
in a stir fry. Yeah.
Yeah.
Okay.
Because to me, yeah, it's that mildness that you spoke of. Like red and orange and yellow peppers to me, like they have like a little varying different bit of flavor, but they're not as good. Like I use green peppers in like bases for like cooking, whether it be like fajitas and stuff like that. So just makes a little bit more sense. You're really judging on the whole like color of the thing. And I just want to remind you that you picked celery.
I like celery, to be
Thank
fair.
you. It's
Also in a stir
crunchy.
fry. It's crunchy.
Yeah. Crunchy, refreshing, negative calories.
Mm-hmm.
You burn more calories digesting and eating it than you
that
get
explains
from
a lot.
which is an interesting factoid for you.
Thanks so much.
You're
I
welcome.
asked for that.
Yeah.
I'm sorry, we're being so catty. This is just how we are.
True.
So next we have blue. I can't wait for this one. Blue.
Take blueberry before someone else does.
I think that's like,
I think that may be the only one.
let me just tell
I
you.
don't love blueberries.
Blueberry muffins?
Okay.
Blueberry muffins.
Yeah.
Yeah, you're allowed on blue. We're just going to establish something. You're allowed to say like unhealthy ones on this one because of like the toxically nuclear like snacks and candies out there. Blue was always like a
best
tiny
flavor.
Zach go-to, or
Yeah.
it's just like, oh Zach, do you want like a make sense color? Like, no, like I want the antifreeze colored slushy, like the
Yeah.
What flavor do you want? Blue.
blue. Yeah, blue is solid.
Blue raspberry from
Yeah.
the slushy stand. Yeah.
But also raspberries, I would argue they're more like black
Black
raspberries,
raspberries are purple.
purple. Yeah, they're
sure.
way more purple. There's no blue in it.
Yeah, I'm thinking. Because even when I was doing my DOT survey, which I didn't even mention in Whitehall about like the top barriers, when I was doing it like in a rainbow way for
Yeah.
visual appeal, and the blue thing that I chose was a carton of milk because there was nothing blue.
Yeah.
So water.
Hey, that's
Yeah.
works.
Last color is pink.
Okay, this is not pink, but I was thinking about this a lot because it's pink adjacent. A watermelon.
Yeah, I
yeah,
take
yeah.
that.
I'll take
Yeah.
that.
Love
I take that.
watermelon. It's my favorite fruit,
Yeah.
especially in season. So good.
Nice.
Yeah, I agree. That is definitely pink adjacent and definitely counts. Ange,
Beets.
gross. Okay, Andrew.
Watermelon's good. I know we'd mentioned raspberries. Raspberries are kind of a reddish, pinkish color sometimes too. So I would go with either watermelon or raspberries.
Zach, is yours beets also?
No,
Just thought
no,
I'd check.
no. It's a good listen. Beets are insanely healthy for you.
They're so
It
good.
sucks that like they just taste like dirt.
No, they don't. Not if you roast them. Then they taste really sweet.
It
Boil
tastes
them and
like
add
it
them to your mashed
sounds.
potatoes.
Beets.
Literally. What'd you say?
It tastes like it sounds.
Beets.
Yeah, sure.
I would say someone said raspberries. Yeah, I would say raspberries. A pink fruit that I need to try, and I don't know if we'd classify it as pink because the inside's not, but like, isn't dragon fruit
Yes.
like
Pink
it's got, like-
adjacent.
Pink, there's pink,
Pink
in,
adjacent and the outside. It's
Yeah.
like hot pink.
Yeah, the outside,
yeah.
but
I
there
haven't
is
tried
pink
it
dragon
enough.
fruit.
Yeah, I haven't like tried it like cut up or anything, but
It's very
it's on
good.
my list of things to like try. So
Yeah.
I throw that in a smoothie when I'm feeling wealthy because it's expensive to buy frozen.
When I'm feeling wealthy, here's
I
what
would
I
like
do.
to have another Learn with Nern segment about how you feel wealthy.
Exactly.
Yeah,
on
how did we
payday.
get to that point?
I go to the grocery store on payday. I spend too much money. I scrounge the rest of the 2 weeks.
Yeah, love. Okay, when you're feeling wealthy, dragon
That's
fruit.
fan-
I
that's
go to the nice
fantastic.
grocery store when we get paid.
That's fantastic. That's a great answer.
Mary Nern, thank you so much for coming on the podcast. She is the Healthy Food Access Coordinator here at Franklin County Public Health. And now I'm being told to, oh, yes, I wanted to include our studio audience one more time. Yes, thank you.
You're all so wonderful. Thank you.
Yay.
Mary, they love you.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Email us your thoughts at fcph@franklincountyohio.gov, and we might respond on a future episode of Health is Real. And also be sure to follow FCPH on all social media platforms for the latest updates.